The following segment is sponsored by Miles of Smiles Implant Dentistry. Today we're hearing from Dr. Sammy Noumbissi about metal-free ceramic implants. His practice is located in downtown Silver Spring, Maryland, where for the last decade he has focused his practice on biological and metal-free replacements of missing teeth. Dr. Noumbissi, we're talking today about metal-free ceramic implants. So I want to ask you, why zirconia ceramic instead of titanium implants do you use?
Well, there's a couple of reasons for it. One is because of the material. I was trained on titanium implants, and they've always been looked upon as the most biocompatible material available. But now we know that there's a lot of issues with titanium, especially corrosion. So ceramic implants, which are not new, are a good alternative to that. So there's a health component to it because if an implant gets corroded in your jaw or in your hip or in your knee, it can trigger a whole host of other health issues. So there's not only a health component to that choice, but there's also an aesthetic component to it.
Yet having that corrode in your mouth does not sound very pleasant. So
no, not at all.
So we like this. All right. So then for that, why is metal allergy testing prior to an implant necessary?
It is necessary because, first of all, metal allergy is very difficult to trace and to identify clearly which metal causes the problem.
Okay.
However, if a patient comes in and declares or doesn't declare that they have an issue with metals, you want to test them, because what's happening is metals don't only come from implants. They also come from heavy metals, especially. They come from the food we eat, from the smoke, the smog in the air, and we live in a big metropolitan area here in DC. So it's good practice. It's not mandatory, but it's a good thing to test the patient, especially if they opt not to have ceramic implants. If they say, you know, I've never had a problem with metals, I'd rather have a titanium implant or metal alloy implant, fine. But it's good to probably test them, because there's some tests out there, although not perfect, they're about 90% accurate, that can give you a good idea what a person is susceptible to be allergic or sensitive to. And if some of those metals, if they get a test and the report comes back and says, well, this person is likely to be sensitive to vanadium or aluminum, which are components of titanium implants, then you probably want to think twice before you go ahead and place a titanium implant in this patient.
So if you're using more and more of the ceramic implants because of those health issues with titanium, then these can be used for everybody, right? Not just metal sensitive people?
No, absolutely. Actually, in my practice, I use them about 95 to 98% of the time. That's the core implant that we offer our patients. However, yes, you know, anybody can get a ceramic implant. Actually, as far as I'm concerned, it's a better alternative.
Looks better, feels better. Now, these ceramic implants, can they be used for all types of tooth loss? Like some people have partial, some people have complete tooth loss. Are they across the board?
That's an excellent question, because originally, no. Now, the technology and the pieces that come along with ceramic implants make it that now it's possible to do single teeth, or like you said, partial teeth, partial loss of teeth, or even full mouths or full jaws. So it can be done. It just requires a lot more attention to detail.
So obviously everybody's mouth body is different, and you are going to determine what is best for them. So how do they find out if they're a good candidate for these zirconia ceramic implants?
Well, usually everybody, like we said earlier, everybody can get a ceramic implant. That's not the issue.
Okay.
Now,
okay. Yep.
Now the second point that you brought, which is very good, is how do they know they're eligible or a good candidate for ceramic implants? And this is where things get a little tricky, because ceramic implants are very, very sensitive to the person's health. So what do I mean by that? If you have a person who is low on vitamin D, deficient on certain nutrients, who is high cholesterol, who is diabetic, who is deficient in magnesium, there's a few things that have to be checked and optimized before a patient is offer ceramic implants because the healing process around ceramic implants is slightly different than around titanium implants. They're a lot more sensitive. Actually, in the trade, we always say zirconia is the diva. So you really have to, that's right. You really have to pay attention how you prepare that patient for a ceramic implant. So the process is longer. It takes more time. You can't come in my office, for example, and get a ceramic implant the day you came in. I have to do some work, some prep work, some evaluation before that procedure takes place.
It's the diva, but it's the better choice for just about anybody. Dr. Noumbissi, thanks so much for sharing this with us and informing us on these.
Yes, things change. 20 years ago, if you had a appendix surgery, they open a flap like this. Today, they do it with a video camera and a little incision. It's the same thing with implants. Metal alloy implants have done very well for 50, 60 years. But today we know more about how they behave, how they break down, the corrosion problem. So now there's an alternative that works as well. It just requires a little more attention to detail.
You can contact Dr. Noumbissi and his team at Miles of Smiles Implant Dentistry to find out if you are a good candidate for zirconia ceramic implants. The number is there on your screen. It is 301-588-0768, or you can visit their website at milesofsmilesdental.net.